10 signs you have throat cancer. Have you ever found yourself constantly reaching for cough drops, assuming it's just another stubborn sore throat? We all do it, brushing off a scratchy throat as nothing serious. But what if that lingering irritation is actually trying to tell you something more concerning? Throat cancer is one of those conditions that can quietly develop while disguising itself as common, everyday symptoms. Many people overlook early warning signs, thinking it's just allergies, acid reflux, or the result of talking too much. But persistent throat discomfort could be more than just a passing annoyance. It might be your body's way of signaling something serious. In this video, we'll uncover 10 signs that could indicate throat cancer, helping you understand what to watch for and when to seek medical advice. Stay till the end of the video, because we discuss what is actually causing throat cancer. Don't ignore the warning signs. Early detection could make all the difference. Let's dive in. Sign 1. Persistent sore throat. Everyone gets a sore throat from time to time, maybe from a cold, allergies, or even talking too much. But a sore throat linked to throat cancer doesn't just go away. If your throat remains irritated, painful, or inflamed for weeks despite home remedies, it could be a red flag. Throat cancer can cause chronic inflammation or the growth of tumors that keep the throat sore. You might also notice additional symptoms like difficulty swallowing, ear pain, or swollen lymph nodes in your neck. While infections like strep throat or acid reflux can also cause long-term throat discomfort, it's crucial to get checked if your symptoms persist beyond 2 weeks. Sign 2. Difficulty swallowing, dysphagia. Have you ever felt like food is getting stuck in your throat? Occasional swallowing difficulties can be due to dehydration, eating too quickly, or minor throat irritation. But if you regularly struggle to swallow food, liquids, or even saliva, it could indicate something more serious. Throat cancer can create blockages or narrowing in the esophagus, making swallowing painful or difficult. You may feel like food is going down the wrong way or experience frequent choking. Over time, dysphagia can lead to weight loss and malnutrition as eating becomes uncomfortable. Other conditions like acid reflux or esophageal spasms can also cause swallowing problems. But if this persists, a medical evaluation is necessary. Sign 3. Ear pain. A sore throat and ear pain often go hand in hand, especially with infections like strep or the flu. But if you experience sharp or dull ear pain without an obvious infection, it could be a symptom of throat cancer. This happens because the nerves in the throat and ears are closely connected. A tumor pressing on throat tissues can send pain signals to the ears. If ear pain is constant or worsens over time, particularly on one side, it's worth getting checked by a doctor. Sign 4. Hoarseness or voice changes. If you've had a cold or have been shouting at a concert, a raspy or weak voice is nothing unusual. But if your voice becomes hoarse or weak for more than 2 weeks without any signs of infection, it could be a concern. Throat cancer can affect the vocal cords, causing the voice to change in pitch, volume, or clarity. Some people describe it as sounding deeper, raspier, or strained. If you notice persistent voice changes, difficulty speaking, or a feeling of tightness in your throat, see a specialist to rule out serious causes. Sign 5. Lump or swelling in the neck. A swollen lymph node after an infection is normal. However, if you notice a painless or growing lump in your neck that doesn't go away, it could be a sign of cancer. Throat cancer can cause lymph nodes to enlarge as the disease spreads. The lump may be firm, fixed in place, and gradually increasing in size. This symptom is often accompanied by sore throat or hoarseness. While swollen lymph nodes can also be due to infections, persistent swelling for weeks requires medical attention. Sign 6. Unexplained weight loss. Suddenly dropping weight without trying? Losing more than 5% of your body weight over 6 to 12 months without changing your diet or exercise routine could be a warning sign. Throat cancer can lead to weight loss due to difficulty swallowing, reduced appetite, or the body using extra energy to fight the disease. Other causes like hyperthyroidism or digestive disorders can also contribute to unexplained weight loss. But if you're also experiencing trouble swallowing, throat pain, or fatigue, consult a doctor. Sign 7. Persistent cough. A lingering cough after a cold is common, but a chronic cough that lasts over 2 weeks, especially one that doesn't improve with medication, shouldn't be ignored. Throat cancer can irritate the airway, causing a persistent dry or productive cough. Some people also experience coughing fits triggered by swallowing. While smoking, allergies, and acid reflux can also cause chronic coughing, if yours is accompanied by throat pain, hoarseness, or blood in the mucus, seek medical evaluation. Sign 8. Coughing up blood, hemoptysis. Spitting up blood-streaked saliva or mucus can be alarming. It might be caused by something as simple as irritated nasal passages, but if you frequently cough up blood, it could signal throat or lung cancer. Cancerous growths in the throat can cause bleeding due to damaged tissue or inflamed blood vessels. If you notice blood in your saliva, have persistent coughing, or experience unexplained throat pain, it's crucial to get examined immediately. Sign 9. Bad breath, halitosis. Chronic bad breath isn't just a dental issue. It can be a sign of throat cancer. Cancerous tumors can create foul-smelling compounds or cause persistent dry mouth, leading to halitosis. If your bad breath doesn't go away despite good oral hygiene, it could be worth investigating. While gum disease, acid reflux, and dehydration can also contribute. Cancer-related halitosis tends to be persistent and resistant to mouthwash or mints. 10. Fatigue. Feeling exhausted all the time, even after rest? Cancer can cause severe, unrelenting fatigue due to the body's immune response. The energy required to fight the disease can leave patients feeling drained, weak, and less able to perform daily activities. Unlike normal tiredness, cancer-related fatigue doesn't improve with sleep or rest. It often accompanies weight loss or chronic pain. If you're constantly feeling exhausted for no clear reason, along with other symptoms on this list, a medical checkup is advised. Understanding the causes of throat cancer can help raise awareness and encourage prevention. Let's go over the most common causes and risk factors. Cause 1. Tobacco. Smoking cigarettes, cigars, or pipes is one of the leading causes of throat cancer. Tobacco smoke contains carcinogens that damage the throat lining, leading to abnormal cell growth over time. Even smokeless tobacco, such as chewing tobacco and snuff, increases the risk by exposing the throat to harmful chemicals. Long-term tobacco users are significantly more likely to develop throat cancer than non-smokers. The risk increases with duration and frequency of use, with studies showing that those who smoke a pack or more daily for 10+ years face up to 25 times higher risk. Quitting tobacco at any age reduces risk substantially, with benefits beginning within days of cessation and continuing to improve over time. Secondhand smoke exposure also contributes to elevated risk levels. Cause 2. Alcohol consumption. Excessive alcohol consumption, particularly over many years, can irritate the throat and damage its cells, increasing cancer risk. Heavy drinking combined with smoking amplifies the risk even further, as alcohol makes it easier for tobacco carcinogens to penetrate throat tissues. People who consume more than 3 drinks per day are at a much higher risk of developing throat cancer. The type of alcohol matters less than the quantity consumed, with all varieties, beer, wine, and spirits, contributing to risk when consumed excessively. Recovery of throat tissue is possible with abstinence, though some damage may be permanent. Research indicates that the synergistic effect of alcohol and tobacco creates a risk that is greater than the sum of each factor individually. Cause 3. Human papillomavirus, HPV. HPV is a sexually transmitted virus that has been strongly linked to throat cancer, especially oropharyngeal cancer, affecting the back of the throat, tonsils, and base of the tongue. HPV infections often go unnoticed, but in some cases they lead to cancerous growths. Vaccination against high-risk HPV strains can help reduce this risk. HPV-related throat cancers have been increasing dramatically in recent decades, particularly among younger patients with no history of tobacco or alcohol use. HPV-16, one of over 100 types of the virus, is responsible for approximately 70% of HPV-positive throat cancers. These cancers typically respond better to treatment than those caused by tobacco or alcohol, with significantly higher survival rates. Regular dental checkups can aid in early detection of suspicious lesions. Cause 4. Acid reflux, GERD. Gastroesophageal reflux disease, GERD, causes stomach acid to frequently back up into the throat, irritating the delicate tissues. Chronic acid exposure can increase the risk of esophageal and throat cancer over time. People who experience persistent heartburn, chronic cough, or throat discomfort should seek treatment to prevent long-term damage. Left untreated, GERD can lead to Barrett's esophagus, a precancerous condition that significantly increases cancer risk. Lifestyle modifications like elevating the head during sleep, avoiding late meals, limiting acidic and spicy foods, and maintaining a healthy weight can significantly reduce reflux symptoms. Proton pump inhibitors and other medications can effectively manage acid production, potentially lowering cancer risk when used appropriately under medical supervision. Cause 5. Genetic predisposition. A family history of throat cancer may increase your risk. While genetics alone don't cause throat cancer, inherited mutations can make some individuals more susceptible to environmental factors like smoking or HPV. If close family members have had throat cancer, regular checkups and lifestyle modifications can be beneficial. Specific genetic markers like variations in the GSTM1 and GSTT1 genes affect how efficiently the body neutralizes carcinogens, potentially increasing vulnerability. Research suggests that approximately 15% of throat cancer cases may have a hereditary component. Genetic counseling can help assess personal risk levels and develop appropriate screening schedules. Those with family history should be particularly vigilant about avoiding environmental risk factors, as genetic predisposition often manifests most strongly when combined with external triggers. Throat cancer symptoms can be subtle and easily mistaken for minor issues, but ignoring them could be risky. If you have persistent sore throat, difficulty swallowing, hoarseness, or unexplained weight loss, don't dismiss them. Early detection is crucial and significantly improves treatment outcomes. If you or someone you know experiences these warning signs, consult a healthcare professional as soon as possible. Your health is worth prioritizing. Stay informed, stay proactive, and take action when needed. Thanks for watching, and I hope this information helps you stay aware and healthy.